Welcome, health superheroes. Are you struggling with slow injury recovery or just feeling your body isn't performing at its peak? Or perhaps you are looking for some science based strategies to look and feel younger as you age? Today, we will explore hyperbaric oxygen therapy or HBOT and how it could supercharge the way your body heals and function. I am excited to be joined by Dr. Scott Sherr, a pioneer in health optimization medicine and a leading expert in HBOT. We will cover how HBOT works and its applications from FDA-approved uses like recovery from certain injuries to off-label benefits from health performance to brain health and even erectile dysfunction. This is the first episode of my new series, Outsmart Your Genes with Science, where we will explore science based strategies to live healthier, longer by activating health promoting genetic pathways, like, for example, cell recovery and regeneration, and silence disease associated pathways, like, for example, those associated with chronic inflammation. It sounds like science fiction, but it's actually based on a true science called epigenetics, which I teach at Stanford University. I'm Lucia Aronica, and I'm a lecturer in epigenetics and nutrigenomics at Stanford University. And so, if we want to help me on this mission to help you elevate your health through epigenetics, please consider subscribing to this channel so that these videos can reach more people. And now let's dive in. Scott, thank you very much for being here. I would love to start the conversation with a picture because a picture is worth thousands words, and to help you illustrate the benefits of HBOT and how it works. So let's have a quiz. What do you think that these pictures represents? So let's give some time. You can think about it, 10 seconds, and then I will have Scott explain what this is and why it's
Should we give a
it
hint? Should we give a
showcases.
hint, anybody? So,
Let me see if there are comments. Not yet. You can go anyway. People will watch the video and join the quiz later. So Scott, you can go and help us understand what's going on here.
all right, rock and roll. Yeah. So this is what's called a functional scan. So we're looking at blood flow here, everybody, and what you're looking at beforehand is a picture before hyperbaric treatment, and after you're looking at a treatment after about 40 to 60 hyperbaric treatments. And what you're seeing here is an increase in blood flow, and this blood flow is very specific in an area of our anatomy, the males that are listening, in the penis itself. And the Israelis actually published a study on erectile function using hyperbaric therapy in healthy aging populations. So this is a population of individuals over 65 years of age and older. And we know that hyperbaric therapy improves vascularization in the brain, in our guy's little brain, as well as you can see here, as well as the cardiovascular system, and in other locations as well. This is called angiogenesis, or the creation of new blood vessels. So yes, this is a picture of a penis before and after a hyperbaric protocol and the improvement in blood flow that was seen as a result of hyperbaric treatment.
That's remarkable. So help us understand what is HBOT and how does it work?
Sure. Yeah, the short story with hyperbaric therapy is it's the combination of increased atmospheric pressure and increased oxygen. So I like to take this in kind of the reverse order of what I just said. So oxygen is extremely important. We need oxygen to help us make energy. If we don't have enough oxygen around, we don't do very well. Um, Oxygen is carried on red blood cells in our body. Red blood cells, their main role is to carry oxygen from our lungs, where it picks up the oxygen to the rest of our body to maintain physiologic function. Red blood cells have something on them called hemoglobin. This is a molecule that binds the oxygen. Every molecule of every red blood cell has 250 million hemoglobin molecules, and each hemoglobin molecule can bind 4 oxygen molecules. So each red blood cell carries 1 billion oxygen molecules. Okay, so this is our oxygen carrying capacity. And so there's a few ways that we can increase our oxygen carrying capacity. And the main ways we do this outside of a hyperbaric therapy treatment is by increasing the number of red blood cells in circulation. So we can do this by coming to visit me in Colorado and going altitude training. Because if you have less oxygen in the air, the body secretes a hormone called epigen, which allows you to make more red blood cells. You can also take this as a drug. If you've been ever following professional sports like cycling, the Tour de France, and Lance Armstrong, this is the drug that they would use to increase the number of red blood cells in circulation. And so it's doping in that capacity. But there's another way to increase the amount of oxygen in circulation, and this is by increasing the amount of atmospheric pressure. So in a hyperbaric chamber, we simulate the pressure you feel under a certain amount of seawater. Water is extremely heavy. If you pick up a bucket of water, we know this is very heavy. If you swim in the water, you don't feel it as much because you're weightless, but all that water above you is very heavy. And so that heaviness drives oxygen into the liquid of our bloodstream, also known as the plasma. And we can get up to about 1,200%, actually even more than that, oxygen in circulation because of that plasma oxygen saturation. So that is a huge amount of oxygen that we can play with in the body. And there's like immediate effects of being in the chamber. And then the long-term effects are what Dr. Lucia is famous for, is the epigenetic effects of this oxygen infusion over a long period of time as a result of the expression of various genes changing because of that oxygen exposure.
That's very interesting. Do we know which genes are turned on and off, activated and
I should
silenced?
have asked, I should have known that before I got onto this call with you. What I can tell you is that there are genes that are responsible for growth, responsible for decreasing inflammation, or responsible for preventing programmed cell death. Maybe you know what those genes are. I don't know the names off the top of my head, but they've noted about 8,000 different genes that are sensitive to
Wow.
pressure and to oxygen. And almost all of them are related to what I just described. So what the sort of end result of that epigenetic shift is angiogenesis, so new blood vessels, stem cell release and maturation, decreasing inflammatory pathways like your interleukin pathways, your TNF alpha, and other inflammatory pathways. And those are the main epigenetic shifts that you see. And then also immune system and wound healing epigenetic shifts that are helping with the healing process there as well.
That's so interesting. So this makes really HBOT a promising strategy, not only for, the FDA-approved applications we will explore now,
Mhm.
more disease-related, but also for health optimization and
Absolutely.
longevity. And so let's first go through the FDA-approved uses of HBOT before then moving to the longevity and health optimization
Mhm.
applications.
So there are 14 indications that are covered by medical insurance in the United States. In some countries, it's a little bit more. In some countries, it's a lot more. In some countries, it's a lot less, actually. But in the US, there's 14. The main ones that the way to break it down is there's the acute ones, so the ones you'd have to be in a hospital for, like carbon monoxide poisoning, gangrene, a limb that's almost amputated, severe infections like flesh-eating bacteria. Those are the ones that I actually trained with when I was in medical school a while ago. The ones we use as an outpatient are diabetic foot ulcers, so we can heal people and so they can prevent amputations. You can also have chronic bone infections treated very well. Radiation injury, so patients that have had radiation exposure from cancer treatment and they get radiation wounds that do not heal after about 6 months. Hyperbaric therapy is really effective at healing these because of the reason we mentioned: new blood vessels, stem cells, recreating the scaffolding of tissue overall. Vastly underutilized for this, actually. Also, flaps and grafts in plastic surgery, and sudden hearing loss. That's kind of a hearing loss related to neurologic capacity of losing hearing. So those are the main ones overall. And then on the other side of things, the investigational side, there's about 50 or so indications that have a lot of great overall data, but not covered in this country or in the US and most other countries as well.
Interesting. I have here a question on sudden hearing loss because actually it happened to my mom, and unfortunately at that time I was not. It was more than 10 years ago.
Yeah,
Yeah. So probably the question is, in these cases, it should be done, I assume, as soon as
yes,
possible. So maybe
yes,
describe what this um, uh, kind of sudden loss
sure,
involves, and how soon it could be done, whether there is some benefits to do
sure.
it later. Yeah,
So the sooner the better with this type of hearing loss. It's a neurologic hearing loss. We don't know why it happens. It's often usually like a viral syndrome or maybe an autoimmune problem. But suddenly you'll wake up one day, and I hope that this doesn't happen to anybody here, is that you just lose hearing. It can be all of your hearing. It could be 20% of your hearing. It could be any percentage of hearing that you lose. Usually it's in one ear and not in both, but sometimes it can be in both as well. And what hyperbaric therapy can do is, like, we think it's a hypoxic injury. We think it's a low oxygen injury to the actual hearing cells, the hair cells in the ear. And so if you can get oxygen to that ear cell fast, just like if it's an acute heart attack, a stroke, a traumatic brain injury, a spinal cord injury, if you can get oxygen to that tissue fast, you might prevent the downstream breakdown of the said tissue, whatever it might be, including in the hearing. And so the studies that have looked at this seem the most benefit within about 2 weeks of having the hearing loss. And now this is different than hearing loss from going to a concert and getting noise-induced hearing loss, for example. Or it's also different hearing loss than from like Meniere's disease, which is a kind of syndrome where you get hearing loss, you get tinnitus, and you get nausea, vomiting, and vertigo, and things like that. That's a little bit different. I'm talking about a very specific type of hearing loss. Although I have seen benefit as well from noise-induced hearing loss over the years as well in some patients, especially if it's an acute hearing loss from noise.
I see. So after a few years, it might not be worth it,
No,
right?
I mean, there's a lot of benefits of hyperbaric therapy as we're
Yeah,
talking
of
about, right?
course. And I
But
think I
I
think
don't,
my
yeah,
mom could benefit in many ways. So now
yeah,
let's explore first the off-label applications, starting with the disease-associated ones, and then moving to the health optimization longevity. So for example, another thing that my mom could benefit from is ischemic stroke.
yeah,
So
yeah,
um, she had many, unfortunately, in the
yeah.
brain. She's still energetic and functioning perfectly, but I think she could have benefit from it. So can you
She could still
explain?
benefit now, even
Ah,
because
yeah.
we do have
Okay.
benefits. There's actually some controversy on the acute side of ischemic stroke because the data is a little bit all over the place, but clinically, people do very well, in my experience, getting into the chamber as fast as possible. You have to just make sure you modulate the pressures appropriately, where you don't want to go as deep of a pressure when they first have a stroke overall. But there was a good study that looked at post-stroke 3 months to 3 years and saw significant benefit. And it's pretty obvious, right? If you have a stroke, you have an area that's blocked, and all the downstream area from that area that was blocked is not getting enough oxygen. Not all of it's going to be dead, though. Some of it will actually be still alive and just need a little bit of extra oxygen to be able to rebuild itself and regenerate. And that's what hyperbaric therapy can do. It can help regenerate some of the tissue within the areas that not are dead, but they're just not functioning at optimal capacity. And like that's, for vascular dementia, it's very common too. So people have the vascular issues causing dementia kinds of symptoms. And so you see this kind of across the board in a lot of different ways that hyperbaric therapy can be used for not only issues related to like stroke or traumatic brain injury or vascular dementia, but also things like Alzheimer's and other neurocognitive issues that there's a lot of inflammation associated, where there's a lot of vascular degeneration, where hyperbaric therapy can help there too.
That's great. So, brain health, not only
Definitely.
for, yes, disease, but also in terms of health optimization and longevity. And maybe I want to share this picture now. I think this shows the cerebral blood flow before HBOTs on the top. You can see everything is blue or and violet, indicating very low flow. And then at the bottom, you can see after, so the effect after, how the is everything like in the green and light blue or red, indicating increased flow. Do you know how many sessions would be required for something, for an effect of this magnitude?
For this kind of effect magnitude, you're probably talking about like 30 to 40 hyperbaric sessions, because
I
the
see.
the main epigenetic shifts that occur, they start happening right away, but the main ones that get solidified are around 20 or 20 sessions into like a more of a chronic indication. So somebody that's had an issue for a long time. Now, if it's an acute issue, you could see some of these changes very, very quickly, actually, because if you can hyper oxygenate the brain, you can see some dramatic shifts very quickly. But in general, it's going to be more of a longer protocol for more chronic issues.
I see. I see. Um, yeah, that's very interesting. So, moving to other disease applications, of course, it's injuries that are not covered from the
Sure.
FDA approved. So, even concussion, for example, traumatic brain injuries. I have many followers that asked that question. So, how soon should you be going? And is it beneficial to even to do it later, a
Yeah.
month later? Yeah.
Sooner the better, as with stroke, but I have seen people get better even years after a traumatic brain injury. It just takes more hyperbaric therapy to see the benefit. And I think this kind of gets to like another big piece of this, Lucia, which is that if you have an acute issue, like an acute trauma, infection, like low oxygen level, you can see massive benefit with hyperbaric therapy very, very quickly, like over just even 1 or 2 sessions. Or if you have an acute surgery, for example, like you've just had surgery, you want to get better faster, hyperbaric therapy is going to help there. If you have an acute infection, like it's going to help, and it's going to help fast. But if you have more of a chronic issue, something that's been going around or going on for 3 months, six, a year, 20 years, then that's where a true comprehensive strategy is really, really important, because the system needs to be optimized not only with extra oxygen, but it needs to have the like optimized levels of vitamins and minerals and nutrients, antioxidants, hormones, gut optimization. And that's where the foundation of my practice, as you know, is something called health optimization medicine and practice. Because if you're not doing that and you have some of these chronic things, I've just found that you don't see them as much of a benefit as you'd like to see. Like, so, the obvious example is like you have somebody coming in with a chronic brain injury, and they're smoking cigarettes and drinking alcohol every day. I mean, what are we going to do here? Are
Yes.
we going to really help the brain if we get them in a hyperbaric chamber? I mean, that's the extreme example. But you have people that have, lots of stress, right? They're always in sympathetic state. They're trying to eat well, but they're still having pizza 3 days a week, and they're trying to heal their brain, but they're drinking alcohol twice a week still. And that's a more common example, right? So
Yeah.
if I say immediately, let's go into the chamber, I'm doing them a disservice because they're not going to see the benefits, right? And so let's take a step back. Let's do some laboratory testing. Let's do some targeted supplementation, some behavioral optimization, some lifestyle things. You've heard of these things before. Behavior and lifestyle, exercise. The stuff, right? And that's really what I focus on. Like when I talk to patients, which I talk to people all the time, like 90% of what I speak about has nothing to do with hyperbaric therapy at all, because that, for me, and when people hear about it, it's the easy part. It's like, here's your protocol. It's going to take this amount of time, and then this is what you can potentially expect. But getting them there might take a little bit of time, and it might take some additional education. It often does.
Yeah. So HBOT is just a tool in the toolbox of
Yes.
optimization, and needs to be integrated with the basics. Of course, it can't do magic. I mean, HBOT cannot outsmart bad habits. Just a question related to that, because you
Yeah.
mentioned, when you have chronic issues, it's tricky. I've seen a study on fibromyalgia.
Yeah.
So, yeah, that's the poster child of a chronic issue. I don't know which protocol was used in that study. I don't recall
Yes,
exactly, but
I can talk about it.
how,
Yeah.
yeah.
Yeah. So when it comes to, so this is a very interesting study. It was done on patients with traumatic brain injuries that also had fibromyalgia. That's who the study was done on. And so the patients, when their brain injuries got better, their fibromyalgia also got better too. So in my experience, if you just take somebody with fibromyalgia and use hyperbaric therapy, you may see a benefit, but it won't be long term. They will see their symptoms recur over time. Unless you're healing something like a brain injury in the case of this particular study, or you're working on some of that foundational work. I've just what happens oftentimes is that you see people benefit in the chamber from some of these longer term conditions, but then their symptoms slowly come on back, right? Sometimes they come back very, very quickly, especially if it's like an autoimmune presentation. I've seen some benefits, for example, in long COVID, which can have a lot of great benefit. But if they're not looking at that foundational side of things, you're not going to see the long term benefit. I've seen people mostly not maintain the benefit that they maybe initially saw after finishing hyperbaric therapy if they weren't working on that foundational side of things too. But from a COVID perspective, seeing a lot of great outcomes here. But I'm doing a full, comprehensive framework with these patients, doing health optimization medicine, or sending them to a colleague that does this work and specifically works with COVID, with long COVID patients as well.
That's great. So for chronic conditions, it's really important to have this holistic approach.
Yes.
And HBOT can help more when is really one of the root causes, like for example, fibromyalgia associated with brain injury. Okay, now let's move to probably the most interesting part for our listeners. So the uses for health optimization and longevity. Longevity is something is a sort of abstract concept, especially in practice, right? We can't really measure it, but we use some functional and physiological markers or molecular markers, right? So I've seen some studies reporting benefits for both categories of longevity associated markers. So functional markers, we have talked about organ perfusion, so from the penis to the heart to the brain, and even VO2 max, for example, and but also molecular markers. We know that there are some hallmarks of aging, some molecular mechanisms that are thought to be causal in the process of aging, including senescent cells, mitochondrial function, telomere length, and studies have shown that HBOT can improve also those markers as well. Can you talk about a little bit those? Also, one question that was asked to me, particularly stem cells. There is stem cell therapies are now very popular. People would like to try them, and maybe HBOT can be a sort of natural way to boost your own stem cells to without having to.
Well, it can definitely do it. It can definitely increase your own body stem cells exponentially, actually, even after just a couple treatments. But they are your stem cells. And so depending on how old you are, they might be older stem cells, right? So there might be still other reasons to get younger stem cells, like umbilical stem cells, for example, instead of getting yours. But from a longevity marker perspective, you mentioned some of them already. VO2 max probably being one of the most interesting overall, because that in higher VO2 maxes or higher increase your chances of longevity overall, living a longer time. And so that was a study done looking at hyperbaric therapy and cardiac function specifically, both the left ventricular function as well as VO2 max. We've also seen some studies looking at senescent cells, which are these zombie cells that I'm sure you've spoken about before, Lucia, that increase as we get older. They're cells that don't divide anymore and they cause inflammation. They're associated with inflammation, as I mentioned, degeneration, cancer, like nothing good. Hyperbaric therapy, at least in a couple of studies, has shown a decrease in the population of those stem cells, but these are more like laboratory research kinds of tools. They're not really available, I don't think yet, to senescent. Like I don't think you can measure senescent cells very easily yet, at least commercially, as far as I'm aware. But if you know something, let me know. And also there is some evidence that, although this is controversial, that hyperbaric therapy can increase telomere length as well. And so whether that's a longevity marker or not is unclear. It may be. But I think for me, looking at inflammatory markers, looking at interleukins, which has been looked at in some studies, like you can see these get better using hyperbaric therapy. So these are all potential ones that you can look at overall. We have some patients that have diabetes that have better glucose markers using hyperbaric therapy because it increases metabolic rate and increases insulin sensitivity as well. So most of these longevity markers, though, it's something that I would be thinking about using hyperbaric therapy, not only just for one protocol, but maybe a protocol over, with maintenance over the long term. And I have a lot of clients that I do this with overall, but if I'm doing this, I'm always doing foundational, comprehensive work as well, because in the end, if you wish for eternal life, you better also wish for eternal youth. Otherwise, it's not going to be that great, living to 130, but you can't move, right? And so that's what
Yes.
health optimization medicine is all about, and that's what
Yeah.
we're doing there. With obviously your help as well on the epigenetic side, is like we're trying to reverse people's age from a vitamin, mineral, nutrient, and hormone network age back to when they were 21 and 30 years of age, and that's when we're most primed to be resilient. Most of those that are listening probably remember when they were 21 to 30. It's a good time to be alive. No worries, just like they say in The Lion King, for the most part, right? Hakuna Matata, right? But for the most of us, not some people, obviously getting sicker and sicker as we get younger. But so that's what we're trying to do with the framework, and it's very robust. When you talk to people, like, well, longevity is one thing, but health span, that's what we're really talking about here, is the other. We want to live as healthy as we can for as long as we can before we leave, as opposed to having, and I think with women, it's worse. I think women have a higher number of years with morbidity and degeneration dysfunction than men do, unfortunately.
Yeah, there is this paradox. We live longer, but
Yes.
we spend more time sick. And I think, there are many reasons for that, from hormonal, genetic, and but I think also muscle mass plays a role there, because women in general
Yes.
have.
Yes. Yes.
But anyway, yeah, it's all about, we all want to live longer, but nobody wants to get older. So we are here for this. Before moving to the protocols, so you are saying basically, yes, HBOT for longevity, but one of the tools in the box to be integrated with other approaches. Just I want to touch on HBOT for our athletic performance. How do you
Yeah.
use it with athletes before exercise, after exercise? Which are the benefits?
Yes, I do it both ways. So you can use hyperbaric therapy before exercise to boost performance, because you're going to have extra oxygen in circulation for about 30 minutes to an hour with improved oxygen utilization after you get out of the chamber. So that's a kind of a cool way I do it, especially for like more elite athletes that are doing trials and training, and they want to go further and lift heavier, be able to do more endurance work as well, because your aerobic threshold will be further away. So you get more aerobic training capacity. Then you can add some methylene blue to the mix. We can talk about that or not, but then you can see a significant benefit as well. On the reverse side of it, you can use hyperbaric therapy with recovery, because it's going to help with the detoxification process after going and doing your exercise. What I would recommend here, though, is that I don't think that you don't want to use hyperbaric therapy right after exercise. You want to do it like a hormetic stress, like you would do cold, right? So you would not want to do cold right after your workout, because that might mitigate some of the hormonal responses that you get after doing your exercise. And so the same thing with hyperbaric therapy, because you are decreasing inflammation. But I work with a ton of elite athletes and weekend warrior kind of people over the years, and they will know that their recovery scores go up if they use hyperbaric therapy after like a long day of training. And you can see it at kind of all different pressures, but typically the milder pressures, like not like deep medical grade full pressure, but like the 1.3, 1.5, 1.7, like those kinds of pressures tend to be best for both for performance and for recovery overall. Because the
I
deeper you go, the more stress you put the body under, right? And so because it's an oxidative load, to go into the chamber, more oxygen around. And so that's not necessarily a bad thing, but it depends on the situation, right? Because if you have somebody that's already under a lot of stress, it may be a lot too much for them to handle. And the point here is that this is how I got involved in doing more of a comprehensive approach, because if you give somebody like a lot of hyperbaric therapy and they have a lot of oxygen in circulation, they're going to make a lot of energy, but they're also going to make a lot of waste products, a lot of oxygen radicals, free radicals. And so the body has to be able to balance that with this antioxidant surge. And our colleague Dominic D'Agostino and Don Carnegas and others put out a paper maybe 5 or 6 years ago on this response. And it takes about 3 days for that response to be kind of at its max, to kind of balance out. And so, but that's only if you have optimized levels of antioxidants ahead of time, right? So you have to be very careful with that, depending on the patient. If they're very sick, a lot of inflammation, already like depleted in antioxidants, so you got to be mindful. And that's how I got involved more in doing the testing and the health optimization aspect of things.
And the protocols. Okay,
Yeah.
I will ask you shortly about the
Yeah.
therapeutic pressures and type of chambers.
Cool.
But before, I just wanted to summarize or comment on this concept of hormesis, which is
Yeah.
basically really the biochemical equivalent of the saying, "What doesn't kill you makes you stronger." What happens is that stressors like exercise or even HBOT really turn on cell defense pathways that then make our cells stronger, but it takes some time. So
Right.
what Scott was mentioning is that actually after exercise, you have more radical oxygen species and more good stress that triggers this hormesis process, and you
Correct.
don't want necessarily to kill that stress taking antioxidants, for example, after a workout, or even something beneficial like HBOT straight after. So it needs to be planned carefully. So this is, I think, a question, a very, a very high level description of what are the different types of chambers and the therapeutic pressure ranges.
Yeah. So the way to think about this is that there's kind of mild hyperbaric therapy, which is kind of defined between 1.3 and 1.5 atmospheres of pressure. It's about 12 to 15 feet of seawater, or maybe 12 to 20 feet of seawater, excuse me. And then you have more deeper hyperbaric therapy, which is kind of below 1.5. And typically, if it's mild, it can be done in a hard chamber, or also can be done in a soft chamber, like a soft-sided unit. Where if it's greater than 1.5 atmospheres, usually it's being done in a hard chamber, like a more of a medical grade type of thing. And that's the first thing. And the second is that if it's more of a neurologic indication, so cognitive, neurological, and I say like overall, like day-to-day operations, like mild amounts of like pain and inflammation, like mild things, then the mild pressures can be very, very helpful, like the 1.3 to 1.5. Like neurologically, you see a good range between like 1.3 and 2.0 is kind of like a neurologic pressure. Okay. But that there's a crossover, because like systemic things outside of the central nervous system are good between like 1.7 and about 2.4. So as you can see, like the ranges are different, but there is some crossover. So it's always good to think about these things in ranges, because some people will respond like really well at 1.3, but others won't respond until they get to like 1.6 or 1.7 in a hyperbaric chamber for a neurologic indication. So it kind of depends on what your goals are. So like, in my house, I have a soft unit that goes to 1.3. They actually now make soft units very commonly that go to 1.5 as well. That's good for, I think, for day-to-day operations, for neurocognitive kinds of things, for mild injuries, nothing too severe. But if there's more of a severe issue, then it's nice to have more of a versatility where you could potentially start at the mild pressure, like the 1.3, 1.5, and then increase the pressure as needed if it's a neurologic thing, or if it's a systemic thing, starting off at like 1.7, 1.8, and then increasing your pressure from there, depending on how people do. So this is what I call dynamic hyperbaric therapy. It's not, it's not your cookie cutter. Everybody gets the same pressure. Everybody gets the same time. I don't do that bullshit. It's not entirely bullshit. It makes sense in some cases, but I'm much more dynamic with things because I'm looking at all these other markers. I'm looking at labs, looking at other supplements and things that I can bring in, other behavioral things and technology, like your lights, your sauna, I'm doing all this stuff, and so I make it all like this comprehensive thing, and so always navigating and titrating as we go.
That's interesting. So, in terms of longevity protocols, so it seems like the science, so based on the literature published, all the longevity effects have been shown only with the higher pressures and
Right.
hard chambers.
Correct.
But clinically, it might be possible to probably see these benefits having, a soft chamber, lower pressure, every day integrated as one tool in the toolbox of a
Yes,
holistic approach.
exactly.
And then once in a while, once every year, get that higher pressure treatment in a hard chamber for an extra boost, right?
Exactly. And actually, you've actually nailed it. Like that's actually often what I'll say is that using the deeper pressures from like a longevity perspective is great to do periodically, but you're not going to want to do that all the time. So I often recommend if people can't afford to get a hard chamber for their house, which, getting a chamber that goes to 2.0 is like going to cost at minimum around 40 or 60K, if not more than that. They could get a mild unit for their house, use it for kind of day-to-day operations, and then go to a facility and go like once every 1 to 5 years, depending on the situation, to get that deeper pressure longevity protocol kind of thrown in there as well. A lot of my patients now have the deeper pressure chambers at the house, and we create protocols where you go deeper sometimes, but not often, and you go to the milder pressures. You kind of mix and match depending on what's needed as well.
That's great. So this also answered the question of that I received: how many sessions, how long? It depends, right? So
Yeah.
maybe probably for acute injuries you need fewer sessions, right? And
Yep.
then for more longevity protocol you can mix and match, and we are still figuring out how actually to integrate this for long-term benefits, right?
Yep, you said it right.
Yeah.
I think it's so.
Yeah.
The more acute the issue, the less you're going to need. The more chronic the issue, more long-term goal, like say it's longevity, the more you're going to need. The sessions themselves range between about at minimum 30 minutes, but that's pretty rare. I have a couple protocols that I do that, but usually it's 60 minutes to 120. So it's like 1 to 2 hours in the chamber, depending on the indication.
That's great. Okay, so one question we all care about: how to find a reputable HBOT provider, and if you also have tips for Italy, where my mom stays, that's a bonus.
Well, I'm not going to make your bonus, unfortunately. I don't know what's available.
Okay.
In most European countries, there is a hospital that will do hyperbaric therapy, but they're pretty stingy, just like in the United States, about what they'll do hyperbaric therapy for. There are some private institutions, at least in the UK, I'm not sure if this is in Italy, that have the big multi-place, like the big chambers that people can go in and pay money and do kind of longevity and other types of protocols. The best way to find a hyperbaric provider is to understand, what kind of supervision that they're going to have at the facility. So if a medical grade chamber, like it's a hard chamber that's going to 2.0 or deeper, you really want to know that there's a medical provider that's going to be available to have a conversation with, to help you design your protocol, to help design what's going to look like in the chamber, that you have an attendant outside the chamber that's making sure that you're staying safe. Those are kind of really important for me. I do work with people all over the world to help them understand what kind of hyperbaric protocol would be best for them. If that's something of interest, people can contact me and we can discuss it. I consult with individuals. I work with clinics all over the world as well, like with practitioners that are integrating hyperbaric therapy within the context of their practice. It could be anything from like a biohacking type of clinic that doesn't really have a true provider, or it could be a provider like a chiropractic neurologist or a rehab specialist or a ear, nose, and throat doctor, or anything in between, where they're bringing in hyperbaric therapy, and I help integrate protocols that way. So it's it's a little bit difficult to find a provider, honestly, without doing a little bit of research. My team can help at my company that does provide chambers and technology. It's called One Base Health, and people can check that out. It's at onebasehealth.com if people are interested. That's a place where we can kind of help find locations or get you chambers if you're interested. The main driver of that company is really the technology making the chambers more optimized overall. But those are some options.
Okay, that's great. We will be checking out your website, and maybe I will bring you my mom when she visits the
I know
the
plenty of places in
United
the Bay
States.
Area. I can give her near
Oh,
Stanford. I
yeah, in
got
the Bay
plenty.
Area. Yeah, yeah,
Yeah.
that would be great.
Yeah,
Okay,
no
mom,
problem.
come visit.
We can hook you up,
So
Mom.
now I would like to switch gears and talk about your upcoming optimization symposium. I'm honored to be invited as a speaker,
Hmm.
where I will be talking about epigenetics, longevity, epinutrition. We can talk about that later. I just want to invite people to check out the Health Optimization Symposium website, and they can use the code Lucia10 for 10% off. Thank you for providing this code to my followers. So tell us a little bit more about the symposium and what people should be looking for, what they will learn, and why they they must attend. They
Yeah.
can't miss out.
It's going to be a fantastic event. And I've been alluding to the foundation of my hyperbaric practice throughout our conversation here with Lucia. And this is the foundation of what I do. Health optimization medicine and practice, or home health for short, was incorporated as a nonprofit in 2017. And this was started by a gentleman, a very prominent physician named Dr. Ted Atracoso. Ted is a tricontinental practice kind of guy, works with athletes, movie stars, government officials, presidents, congressmen, those kinds of people. And he created this framework that's really a health focused framework. And it's a 7-module certification course that's been created for practitioners, both licensed and unlicensed, that are looking to find ways to optimize the health of their patients rather than treat disease. And there's a lot of specialties out there now that are looking at like root causes of illness and disease, and I think those are helpful. But there's only one specialty that's actually trying to keep you healthy, and that's health optimization medicine and practice. And so we had our first symposium last year in Florida in October, actually just about a year ago now, in 2023. It was fantastically successful. We brought in a number of speakers, including Lucia and my colleague, Dr. Dominic D'Agostino, who spoke. And it was really great. We had CME credit. And for anybody that's interested in learning about, health from a very new framework perspective, and understanding that there is a rising tide of people that are understanding that you can't just be treating things reactively, right? You have to be treating things holistically and responsively. And the way to best do that is to look at health markers, not just to treat disease, but actually to keep people healthy. And so, yes, I'm very excited that we're going to be having our symposium this year in Las Vegas, December 11th and 12th at Caesar's Palace. We are doing this right before the A4M conference, which is a prominent conference that happens every year in Vegas around this time for integrated providers. I'll actually be speaking at that one on the GABA system, interestingly enough. I spoke last year on methylene blue at the A4M conference. At our conference, at the Health Optimization Medicine and Practice Symposium, I'll be speaking about immune system optimization, a little bit about hyperbaric therapy, and about a very cool mushroom called the cordyceps mushroom, which is also something that takes control of insects and makes them zombies. Very famous in a show called The Last of Us, and a video game prior to that. The show on the HBO was very, very popular. So it's going to be very exciting, and I'm very excited that Lucia is going to be one of our keynote speakers at this particular conference for these 2 days.
Wow, I'm excited. I can wait to learn more. I'm sure there is some epigenetic mechanisms behind the cordyceps power.
Yeah.
I really want to say I'm very proud. So we connected 10 years ago, and I helped health optimization medicine and practice develop their epigenomic course.
Yes.
I condensed basically all my university level teachings in clinician friendly modules where clinicians can really start and understand how to apply epigenetics in clinical practice. And I believe that Home Hope is really pioneering a new approach to medicine, where pushing the
Hmm.
boundaries between, you are taking all these emerging sciences, including epigenetics and HBOT even, and really bridging the gap with the clinical applications, because there are lots of things, including HBOT, where there is just the science, there are some approved applications, there is so much more that works in the practice, and you are just catalyzing and accelerating this process. I'm so proud to be part of it. So I will include a link to the symposium and to the epigenomic module if you want, if you
Yes,
are a clinician
please. Yeah.
interested to learn more in,
This is
in
a
the in the
fantastic
course.
module, everybody. Yeah, my goodness.
Oh yes, it
I
is.
remember
Of
yeah,
course. I
yeah,
mean,
yeah.
I really, I really condensed all my lectures and Scott helped me tailor that content to clinicians to make sure that was really addressing their most pressing questions, and is the best is CME certified.
Yes,
So
so we
you
have, I
also,
think, 35 CME credits from finishing the module,
yeah.
and we made this like one of the first, I think, clinical focused epigenetics courses out there. I mean, using Lucia's, decade plus knowledge here. I remember meeting with you on campus at Stanford and going through this, at like a nighttime kind of meeting. It was getting cold, and we're just so excited to get started so many years ago. And it's been an evolution for you, for us, but this is a fantastic module, and we've got a lot of great responses. So yeah, please, if anybody's interested in listening, I would highly recommend taking a look at this particular module, and then seeing Lucia come speak at the conference as well on epigenetics, and I think featuring a couple different things, right?
Yes, yes. I will be talking about the link, so the role of epigenetics in longevity. Epigenetics is one of the hallmarks of aging, and I will present the results of our latest study. It was featured on the Netflix documentary "You Are What You Eat" Twin Experiment. If you didn't watch the documentary, I invite you to watch and share
So
your
famous.
comments with me. I will explain, help people understand interpret the study and what in general the use of epigenetic clocks in medicine. So the promises and perils of using these clocks. Most importantly, I will focus on practical applications of epigenetics, specifically a concept I called epi-nutrition, which is
Mm,
really applying nutritional epigenetics, bringing epigenetics into people's kitchen, identifying the foods that really support your genes and how to cook them and prepare them to retain their benefits. We will, for example, discover one of my favorite epi nutrients, so nutrients that are essential for the functioning of your epigenome, which is sulforaphane. Sulforaphane
nice.
is a little the boss, I think, the boss of your own antioxidant genes. We were saying all this concept of this, outsmarting your genes with science. This is an example. So sulforaphane is an epi-nutrient, is not an antioxidant itself,
Right.
but it turns on a cascade of anti-inflammatory genes that really protect your cells from the inside out. And it's contained in cruciferous vegetables, things like Brussels sprouts, broccoli, watercress, and more. And epinutrition is not only about the foods that support your genes, but also how to cook them to preserve their benefits. So let's take a quiz. Scott, this question is for you. Which of these foods should you avoid freezing? or buying frozen? And then if you can tell me why, you have some bonus points. Blueberries, liver, spinach, or chicken?
Ooh, this is a good question. Um, so I'm going to answer this, right?
Yeah, of course.
So my answer here would be, I think I'm right, but I could be wrong, is you do not want to buy spinach frozen.
Oh, you are right. But
Yes.
now you need to tell me why and explain the reason.
I think that the freezing process does something. I think I'm not sure which of the minerals or the vitamins in spinach, but and you can tell me which one. But I think it as a result of like the freezing and the lattice structure within the spinach of the actual ice, you mess up some of the vitamins and minerals. I don't remember which ones though.
Yeah, so actually, this is an example of things I would talk about during the symposium. So
Cool.
practical applications. The reason is that so both spinach and liver are great sources of
Iron.
folate or
Oh, and
vitamin B9, which is
sure.
one of the epi nutrients I talk about.
Yeah.
The problem is that the folate in liver is actually resistant to freezing and cooking. It's in another form. It's actually most of it is in the activated form, the methylfolate. And
Mm.
certain people who carry some genetic variations in the MTHFR variant cannot activate so well. So that this form of folate is resistant to freezing and cooking. The folate in spinach is in another form, which is actually, unfortunately, it get destroyed with broken down with the freezing and heating. So the three tips for you are: go fresh. So no frozen spinach. Then when you cook spinach, just saute for
Light
two,
saute,
three
yeah,
minutes,
light saute.
yeah,
Yep.
lightly, and maybe consume the cooking water where some of the folate that
Cool.
survives escapes. Right. So um, I will be giving these tips during the symposium. So Scott and I will
I'm glad
be
I passed the exam.
thrilled. Yeah, you passed the exam. There are some more quizzes, so
Cool.
study before our symposium.
Good.
You will
Good.
be
Good.
my my students student in the audience. Okay, so and I invite people, if you enjoy this content, I actually have a free list of top epigenetic foods that you can download. I will also put the link in the description, and you can find it at draronica.com. So, Scott, thank you so much for being with us today. I will be seeing you at the Health Symposium in Las Vegas, and I hope to see many of you. Please join us and help us transform health, disease medicine into health optimization medicine. See you there.
Thank you.
Ciao.
Thank you. Bye bye.
Bye. Bye.